Hi, this is Paul, Business Manager at Speech and Voice Therapy Center. This video is a small sample taken from Sharon's online course called the P.I.E Approach Level 1 Holistic Approach to EILO. This course is for speech pathologists. We wanted to give you a taste of what you will learn if and when you take the course. So enjoy!
So in the dysfunctional breathing assessment, I look at dysfunctional breathing in a variety of tasks. One is at rest. I also look at it through, and I'll talk about that more in a minute. I look at capnometry, and there's some videos that I'm going to play for you, talk about that. And also I look at how the patient's breathing when they're moving, and I get their SpO2, their pulse oximetry in all tasks, whether they're at rest or movement. Before I go on any farther, I just want to say that I get written authorization, of course, to video record these patients especially in the move. I don't really video record them at rest, but in the movement ones, that's when I record. So for those of you who don't know what a pulse oximeter, here's an example of some pulse oximeters right here. And what it measures is the heart rate and also how well the blood is oxygenated. So you can see I'm 100%, or it might change, 99, but I am fully oxygenated. And so that is normal. So anywhere in like the mid 90s at rest to 100 is normal. And then my heart rate is slow. I have a slower heart rate. It's 51 beats per minute. And I do take the pulse oximetry because I just always want to make sure that they are well oxygenated. Most of the time they are, like 99% of the time, but every so often you'll run into a patient and it's low. And you want to have that information and then ask more questions about history, about any question about any kind of asthma or anything like that, especially if you see it consistently. Of course, sometimes you'll get readings that are a bit off, and that's probably because your battery is low. So check it on yourself first, and also check your batteries. But you do always want to make sure that they are that there's enough oxygen in their blood. Okay, so that's why I use that.